I'm Dr. Kavita Chintala. I'm the consultant chief pediatric cardiologist at Apollo Health City, Jubilee Hills. This is Parvati Rohra. She's about 4.5 years old when she came to me about 6 months ago. The family had got this child who was apparently quite sick for quite some time. She was severely jaundiced and she had a complex heart disease. The family had sought medical attention in several places, including out of state, and they had come with a lot of hope and expectation from us. So I looked at Parvati. She was frail, severely jaundiced, and she was quite sick and irritable. So my initial evaluation included a detailed assessment of the heart, which on an echocardiogram showed that she had multiple holes in her heart called ventricular septal defects, and her pulmonary arteries, the arteries that supply the lung, were severely narrowed and fibrous. So she had multiple levels of obstruction in her pulmonary arteries that were quite severe. So in thinking about this child, how we could help her, she had obviously complex issues that we had to deal with, predominantly involving the liver, which was had biliary atresia and cirrhosis, and she was a candidate for liver transplant. And then this procedure was hampered by the fact that she had severe complex congenital heart disease. So in discussing the case with the team, I involved the liver transplant team, the cardiovascular surgical team, and we had to come up with a plan that would suit Parvati and take her through this high-risk situation. So our initial assessment was that it was probably better to deal with the heart and subsequently subject her to liver transplant, but this of course had to happen with multiple discussions amongst the team and the family. And then we decided to take her for a complex percutaneous procedure through which we attempted to open the pulmonary valve that was tight and also to dilate the pulmonary artery that was stenotic. So after intense discussions about the high-risk nature of the procedure, having consent from the family, which were fortunately very cooperative, and they were willing to go through the procedure despite the high risk. So we took her to the cardiac catheterization lab, where we used some special balloons, including what we call the cutting balloons, to try and open her pulmonary artery. Now her pressures in the right side of the heart were extremely high, more than that of her blood pressure, which is a little unusual, which showed how much of a high pressure her heart was, and this would face the liver as well. So she was really a high risk candidate for liver transplant on account of her heart condition. So after the balloon valvotomy procedure, the pressures in the right heart were only mildly decreased, I would say about 75% decrease. So we got less than 50% response from this procedure, but fortunately she tolerated the procedure well. We were able to bring her out without any complications. Then the next step would be, again, we had the discussion of whether with this pressure, would she withstand a liver transplant, or should we further try to get the pressures in the right heart down. So again, we had a team discussion, and then we felt that she was at high risk of liver transplant with her underlying residual heart disease. So we decided to take her through a complex bypass procedure to clear her outflow tract obstructions before she went to the liver transplant. So this is where I involved Dr. Girish, and she was taken for surgical procedure to relieve of her obstructions in the pulmonary artery. Dr. Girish.
I'm Dr. Girish Warrier, Senior Consultant Pediatric Cardiac Surgeon at Apollo Hospitals, Jubilee Hills, Hyderabad. I was involved with Parvati from the beginning when Dr. Kavita talked to me about her condition. Our major concern was whether she would tolerate a heart surgical procedure when she had a liver problem. So as Dr. Kavita mentioned, we planned for an intervention procedure without doing a surgical one. Unfortunately, it did not give the desired benefit for her. So then we had to take a call on whether we could do the surgical procedure instead. Our concern was that her liver was in such a bad condition that she would not be a good candidate for surgery in whatever surgery she would have, like not only cardiac surgery, any surgery. And moreover, cardiac surgery in liver cirrhosis type C, child C, is very, very critical. The mortality is very high. But in this baby, we didn't have any other choice. So we decided to go ahead and operate on her. Our main concern was to relieve the obstruction from the right ventricle to the pulmonary artery, that's the artery to lungs. She had, as Dr. Kavita mentioned, multiple levels of obstruction below the valve, at the valve, and above the valve in the branches of the pulmonary artery as well. So we had to patch the area from the valve up to the hilum of the left lung, so that there will be no obstruction to the blood flow from the right ventricle to the pulmonary artery. Unfortunately for her, she still had some obstruction, because of which I had to cut a little more downwards into the heart. And fortunately for us, she tolerated the procedure very well. Our plan was to take her for surgery for the heart first, and then, without actually taking her off the ventilator, we would proceed for the liver transplant as soon as possible, so that she would not have much of a bad effect of the heart surgery as such. Dr. Manish also was in the operation room to help us in this procedure, and fortunately for us, we could come off the bypass machine when we were doing the operation without any significant events. And in the post-operative period, the heart picked up very well, and the parameters, blood gas parameters, were very good. So then we decided to proceed with the liver transplant the next day. Within, I think, 18 hours of surgery of the heart, we could proceed with the liver transplant. I also got involved with the liver transplant team, because we were not sure how she would behave during the liver transplant itself. So I was on standby with her while we operated on the liver.
Hello, I am Dr. Manish Varma. I am the Chief Liver Transplant Surgeon at Apollo Hospital, Jubilee Hills, Hyderabad. We were faced with a unique situation in this case. There was a bad heart, and because of that, we could not do a liver transplant. And there was a bad liver, because of which we could not do a heart surgery. Logically, the logical solution was to do both of them together, as close to each other as possible, so that a good heart at the end of a good cardiac surgery would be able to support a liver transplant, and a bad liver would not be there in the body long enough so as to cause a threat to life after the cardiac surgery. So this is exactly what we did. But this challenge was very unique for us, because whenever we looked into the medical literature, there was nothing of this kind ever done so far. There were cases wherein a balloon angioplasty was done, and what Dr. Kavita had attempted, and then once the heart was corrected, then the liver transplant was successfully done. But in this case, unfortunately, we were not able to achieve a good result at the end of the ballooning procedure, the angioplasty. So we discussed with the family, and this procedure being a very high risk one, we needed the family to understand, and we needed them to be completely with us, in sync with us, as far as understanding the complexity of the case is concerned, and in taking the risks and accepting an untoward event if at all this would have happened. So as Dr. Girish said, we went ahead with the cardiac surgery first. The extent of the surgery was more than what we had anticipated, and definitely the bypass time was also a little more than what we had anticipated. The liver took a hit, but then before the liver completely went into failure and the child became very sick, we were able to do a liver transplant. It was a big multidisciplinary exercise. We had Dr. Kavita, Dr. Girish, all of them inside the operation theatre even at the time of transplant, and the entire team was geared up to take care of any eventuality if it arose. The most risky thing is at the time of reperfusion, when we put the new liver in and we release the flow of blood into this new liver. That is when the cardiac events happen, and people go into, the heart goes into a standstill, the heart gets stressed to a maximum limit, and then if bad things have to happen, people have something like a heart attack, or the heart just stops working and during the operation itself. So we had Dr. Girish there in the theatre, we had Dr. Kavita there to make sure that if such an eventuality arose, then we would be able to take care of it. Our excellent anesthesia team headed by Dr. Manjunath and Dr. Meena Trehan They did an excellent job, and we were able to take care of the transplant. The transplant was carried out using a small piece of the mother's liver. She donated the left lateral segment, which is segment 2 and 3, and that segment was enough for the baby, and this transplant happened successfully. Post-operative period was also challenging, and she was in the ICU for almost 10 days. And however, I think it's the faith of the family, and it's their belief in our team and in medical science in general that she was able to come through this successfully. We see a lot of families wherein when they are faced with a complex situation, they go into some alternative medicine, some country medicine, and they'll get into more trouble. This family, I think, is a very, very strongly knit, close family and very supportive of each other, and they were able to get this kid through all these things successfully. I think the faith and the belief that they had played a major role to drive us also to do something this complex. Our colleagues, a lot of them from different centers, when we spoke to them, they actually discouraged us in doing this, saying that this has not been done so far. But then we were sure with our team here, and whenever we had this multidisciplinary meetings, we were kind of sure that if it has to happen, it has to happen at our place. An exercise of this magnitude cannot be done without a very proficient multidisciplinary team. And in this endeavor, we had all different specialities. We had, apart from transplant, cardiac surgery and cardiology, we had pediatric intensive care, we had pediatric infectious diseases, we had pediatric nephrology, we had the general pediatricians. All these people involved, along with our intensive care nurses, physiotherapists, dietitians. So it was a multidisciplinary exercise of humongous magnitude, and it did take everyone to perform at their individual 100% to make sure that we were able to successfully get the kid out of the hospital. So this could be achieved only because of the excellent infrastructure at Apollo Hospitals, Jubilee Hills, Hyderabad. And this center has got all the equipment, all the modern technology, and it has got specialists who are trained at the best centers of the world and of our country itself. And this kind of a amalgamation of infrastructure and expertise is possible only and only in Apollo Hospitals, Hyderabad.
I am Rohra, Parvati Rohra's mother. इसका भी लिवर ट्रांसप्लांट और हार्ट ऑपरेशन भी हुआ। 3-4 डॉक्टर्स ने मिल के किया। हम लोग बहुत डर रहे थे करके कैसे होगा, कितना रिस्क होगा, तो भी हम लोग ने रिस्क उठाया और आगे बढ़े। तो ऑपरेशन एकदम सक्सेसफुल हुआ। मेरे फैमिली मेम्बर्स ने बहुत सपोर्ट दिया, मेरे को सबका सपोर्ट था करके हम आगे बढ़े, और अभी 2 मंथ्स ऑलमोस्ट फिनिश हो गया है, और अभी इसकी लाइफ मुझे लग रहा है अच्छी हो गई है, पहले से बहुत इम्प्रूवमेंट आया है पहले से इसके में। ऑल डॉक्टर्स हेल्प एंड सपोर्टेड अ लॉट। डॉक्टर कविता चिंतला, Dr. Manish sir, Dr. Girish sir, Dr. Meena, Dr. Sasidhar Reddy and Manjunath doctor all helped a lot. Thanks a lot, Apollo Hospital.